Good morning, everyone. Good morning, everyone. So we wait 1 minute at least, so everyone can join in. Good morning, good morning. We will start in a minute. We still have people join. Good morning. So we wait a few seconds and then we will start. So I will already share my screen. So good morning, everyone. I am Arthur Guichet, Secretary General from the European Water Association, and I will be moderating today's event. So I hope you can see my screen properly. And today we will be talking about antimicrobial resistance, AMR, and the Urban Wastewater Treatment Directive Recast, so urban wastewater surveillance in practice. And we will start now, as the webinar is an hour long. So the European Water Association, a few words about ourselves first. EWA, we are an independent, non-governmental and non-profit organization dealing with the management and improvement of the water environment. We have members from nearly all European countries. We have national members, corporates such as IDEXX, our sponsor today, that we'd like to thank for the support and allowing us to provide this event free of charge for the participants. And we also have research members. And as you see, we have a variety of actors, and we aim to provide a platform for discussion on technical and policies issues in Europe. And we aim to do this by organizing conferences, workshop, meeting, joining some working group or expert group from the European Commissions, and to some of our publication. And as you can imagine, the Urban Wastewater Treatment Directive is a high topic on our agenda, and today we will then focus on AMR on it. So a few house rules before we start. So please use the chat function to interact amongst you as a participant, but please use the Q&A box in order to submit your question. That will be easier for me to track than to have to track the Q&A and the chat. And as we will take the presentation one after another, please also indicate to whom your question is addressed. Please note that this event is recorded and the slide will be shared. You will receive the slide normally today and a link to the recording by early next week. So please, you cannot switch on your camera and your mic as participants, so do not need to raise your hand. So that's for the few house rules for today. And I will go straight by introducing our four speakers today. So the first one that will be talking to us will be Ben Gavlik. You are portfolio co-leader for climate and water resilience at the European Commission, and especially for the Joint Research Center, GRC. So you are, as I said, co-leader of the GRC portfolio for water resilience, as well for better preparedness and response to crises at the European Commission Joint Research Center. Your primary responsibility is to provide scientific support for the design, implementation, and monitoring of EU water-related policies. And you actively collaborate with various stakeholders involved in water-related issues and has contributed to over 100 publications and reports for the European Commission. So your work emphasizes the interconnectedness facilitated by water and its pivotal role in societal promises, including health. Is expanding wastewater-based surveillance to link this data with other information systems on demography, migration, behavior, and health, ultimately, to establish use water intelligence as additional intelligence source complementary to OSINT, the open source intelligence, and similar sources. Your biography is long. This has already impacted critical EU legislation, such as the recast of the Urban Wastewater Treatment Directive, and especially Article 17, the cross-border threat regulation, as well as the medical countermeasure strategy, which has established the EU Wastewater Observatory for Public Health. So thanks for being here. Then our second speakers will be actually a duo presentation by Claudia Topali, Head of EU Affairs and Government Relations at IDEXX. You lead EU Affairs and Government Relations since 2019. You are based in Brussels, and you drive the company engagement with EU institution, member state, and key stakeholder on water policy, microbiology, and public health. You work over the main EU framework on drinking water, bathing water, urban wastewater, water framework directive, as well as cross-cutting water and sustainability initiative, where she promotes science-based and innovative approach to water quality and safety across Europe. And if I understood correctly, Dr. Brent Brewin, Global Senior Scientist at IDEXX as well, will also be talking during your presentation. So thanks to you. And last but not least, Sophie Courtois, Head of Microbiology and Quality Sensor Department at Suez. So you lead research and innovation activities related to water quality monitoring with a focus on microbiological analysis, pathogen detection, and antimicrobial resistance AMR. So it's really a coincidence that you are here with us today, of course. So you work combine molecular biology approaches and innovation sensing technologies to support operational monitoring in drinking water and wastewater system. So you have a long-standing experience in coordinating private and national research projects and contribute to scientific committees, including standardization activities. So again, please feel free to use the chat for our participants. Please use the Q&A box. Name the speakers to whom your question is addressed. Each of you speakers will have roughly 10 minutes for your presentation, and we'll take questions from the audience after it for the rest of the event. So Ben, I will share the screen and the floor will be yours.
Thank you, Arthur. It would be so much easier if you just present me as the water guy from the Commission. These biops are always giving the false impression that we are experts of everything. I just happen to know most of experts on specific subjects, and they're helping me to bring in occasionally some meaningful messages to EU policies. So same here for AMR. AMR in the recast of the Urban Wastewater Treatment Directive. And of course, what I'm presenting is not my work as Bernd alone. I have a great team. I just would like to outline here Julia Panzarella, Aurora Hirvonen, who by now is not anymore in the JSC, but works in the medical area, and Simona Tavazzi, amongst many other experts and inputs, helping us to make this proposal, which is now at the hand of the member states and the European Commission. Next slide, please. Okay, so the story of AMR is a complex one. It has already been recognized as strategic concern for the Commission more than 2 decades ago. And we tried already 10 years ago to bring it into the water reuse regulation. We failed to do so. And now we are more happy than ever that the recast of the Urban Wastewater Treatment Directive introduces for the first time, and I believe we can say it's globally for such a huge economic area, specific legal requirements for monitoring AMR in urban wastewater systems. This process started actually in 22, and we are now, let's say, in the moment of the implementing act. Next slide, please. So the JRC was tasked to come up basically with a proposal on how to do so. As Science Service of the Commission, this is what we normally do. We accompany the conception, implementation, and monitoring of and EU policies. And so we always start from what does the law say? And the Urban Wastewater Treatment Directive is actually rather generic when it comes on AMR. In its recital, actually, it refers to the need to increase the knowledge on the main sources of AMR and further develop our scientific knowledge and derive consequently actions from this. And the Commission is tasked indeed to establish a minimum frequency of sampling and methodologies. So you see from this background that we are not talking at all about the context. Are we talking about public health? Are we talking about environmental health, One Health, what have you? And specifically Article 17.3 established that this requirement of monitoring AMR has to apply for agglomerations of 100,000 person equivalent and above, so rather big wastewater utilities, and still this is a significant number, and has to be adopted by the 2nd of July 26. And already now I can anticipate that we will fail a little bit this deadline. It will most likely be rather autumn 26. Anyhow, next slide, please. We developed an understanding that the purpose of AMR, ARG monitoring serves a dual purpose. As I said before, knowledge generation is very important, but we cannot deny that there is a direct public health interest in this topic, and in particular also the EU One Health Action Plan against AMR seeks support from this. So that's basically what emerged in the designing of this proposal as the mission to accomplish a dual purpose. Next slide, please. So I think you were a little bit there. The pathway to harmonization indeed started in autumn last year, where we circulated a stock-taking review on AMR monitoring in the implementation process of the Urban Wastewater Treatment Directive. We then revised actually our monitoring approach and received, I think, over 700 comments, just to give you an idea on how complex this was. And by June, end of this month, we will actually publish our comprehensive technical report, results of which I have presented already at the expert group meeting on Monday in Brussels, and which I'm repeating right now in this presentation. And parallel to this, the JSC is developing suitable reference materials to support standardization efforts. Next slide, please. So in this task, we were accompanied by a number of experts to whom I would like to give credit here. I list them here namely, but I also have to stress that these experts are not endorsing automatically by the fact that they contributed to the review, the position and proposals of the JSC. I think this is very important. And for fairness, not all experts are 100% behind what we are proposing. Nonetheless, you see that we tried to bring in different angles and perspectives. And this was a little bit the problem we had. We had, for instance, in the consultation, sometimes situations that from one member state, instead of one opinion, we received 6 conflicting opinions. And that is a task that didn't really make our life easier. And follow up on this one. Next slide, please. Well, basically, the report which I'm referring to, of course, had input from EU member states, competent authorities, but also, for instance, the Health Security Committee or the Joint Actions, JAMRAI, and EU WISH, as well as the EONet AMR task force contributed to this. I believe the colleagues from EU WISH are actually showing this live stream right now in their meeting are taking place in this very moment. We are, of course, as we do, and we disclaim this very carefully, assisted the processing with AI, or the queries and all the use of AI technology has been properly described. And at the end, of course, however, the human factor described or took the responsibility of what is in there. It was actually one of the first times that we used AI technology to process this. And then, of course, we complemented this by desktop-based review by the JSC. Some descriptive statistics on the different inputs is also included in the report. Next slide, please. I mentioned already this one. We can skip this for the sake of time. Just would like to go a little bit to the statistics. When we called for relevant EU studies on AMR, we received 109 scientific references from 12 member states. And we identified in these studies 336 genes in 17 water-related environmental matrices. And this shows you already, first of all, 2 things. Not all member states contributed, and not all studies were specifically only for wastewater. showing that we do have a knowledge gap. Next slide, please. We also identified actually the antimicrobial resistance genes reported by matrices. And of course, what you see here in the square circle is those who are primarily related to wastewater, treated wastewater, influent, outlet, or somewhere in between, all were taken into considerations. When it comes to the wastewater treatment plants which are going to be affected by this monitoring requirement, you see on the right side here a visualization. It is a significant number. It's certainly more than 1,200. I think the latest figure is 1,375 or so that have to implement this. And this makes it indeed very important that we keep in mind what are the operational implications of a monitoring requirement at local level. Next slide, please. Of course, we received input on the different sample opportunities. A lot of samplings actually are also taking place in strategic locations. And we identified basically the practices on sampling in Switzerland and Germany as somehow outstanding and the best one, in particular when it comes to integration of flows. Next slide, please. The analytical methods reviewed included technologies employing PCR, real-time qPCR, and digital droplet PCR, high-resolution genomic techniques, but also emerging and complementary technologies, lab-on-a-chip, multifold platforms, MALDI-TOF, mobile devices, and what have you. Next slide, please. And what emerged very clearly was from the very beginning, as in other water legislations, there was immediately a sort of conflict, or not conflict, but a different perspective, depending whether you go more for a genotype or phenotype approach, whether you're more interested in operational parameters or in the health-relevant parameters. And this is expressed indeed by the approach cultivation-based versus cultivation-free technologies. I summarized here a little bit the different aspects being discussed in our report. Just go to the next slide, please. And we also considered, of course, the state of play in the member states. Actually, as far as we have seen, currently only Sweden is the only member states in the European Union with a binding legal requirement for AMR-related monitoring. And all other member states so far rely on voluntary or mainly research or pilot-based initiatives for urban wastewater treatment directives. I mentioned already the different EU initiatives. So, next slide, please. And all this culminated into the following proposals. So this dual application actually resulted in what I like to call sometimes dual framework, so in which we allow culture-based methods as well as molecular-based methods targeting specific genes. And the targets we have identified are a result of a prioritization process evaluating all the literature I described before, and also in line with WHO documents and lists we received, for instance, from ECDC prioritizing this. So we suggest for the phenotype part of the method to focus on two priority targets, ESBL producing Enterobacterales and carbapenemase producing Enterobacterales CPE, plus the indicator species Escherichia coli. We do explicitly allow solid and liquid-based approaches. This is an analogy to the Drinking Water Directive, and we are referring and recommending indeed already existing ISO standards or ISO standards in preparation. We clearly suggest and recommend a 24-hour flow proportional composite sampling at inlet and outlet of the wastewater treatment plant. Our wish from JSC side is to do this 4 times per year, although in some cases seasonal flexibility doesn't really matter so much. It does in some other cases. And in terms of molecular methods, we identified the following 7 targets. We also strongly recommend a voluntary approach on metagenomics because we are aware and communicated this very clearly that we are searching a little bit under the light and we may miss the bigger picture. In our methodological framework, it was important for us that we avoid a situation of monopoly. And let me make here a very blunt statement about some comments we received accusing us that we would fancy one specific producer on liquid culture-based method. Our market research identified 6 companies offering this technology, and by the fact that we are allowing also for solid culture-based methods, we do not have a situation of monopoly. For those scientists who came forward with this, I would also like to make a very strong comment from Commission side. One must be aware that these allegations can have serious implications. So the fact that you perceive that there is a monopoly situation but do not have evidence for this should put you in a position to be a little bit more careful how you're communicating about it, because the Commission takes these allegations very seriously. It costed us a lot of effort to further inquire about this and make sure that we are legally on the safe side, but this is now the case. So next slide, please. As I said, the methodological framework refers to culture-based methods, and we would like to have indeed a reference to unit of measurements which are independent of what approach you are using. So we will talk about numbers per volume of wastewater, and this is in analogy again with the Drinking Water Directive. While we have for the culture-based methods a set of ISO standards existing or upcoming, for the molecular methods we performed an own method validation and are sharing these findings. This has been complemented also by the application for innovative methodologies, because we wanted to make sure that the implementing act remains open and innovation friendly. This was an explicit request from some Scandinavian countries, where you have actually players dealing with startups and facing actually a very critical situation. And under the remits of the Water Resilience Strategy, Commissioner Oswald is very keen that future legislation keeps an open arm for innovation upcoming. Next slide. Final conclusion, we believe that the implementing act should, by this work I presented, define an harmonized minimum baseline. So member states are free to go beyond that. However, they are also allowing a stepwise approach. Initial achievable requirements can be strengthened over time. And we believe that the work done and undertaken by the joint actions EU-WISH and EU-JOMRI 2, as hopefully others which are upcoming, are very important. The approach offers flexibility, stepwise implementation, allows data integration from clinical, veterinary, and environmental side, and it recognized the method limitations, requiring that this implementing act has to be reviewed once we have collected a first database. We also believe that WISE 6 may serve as a reporting data flow. So this is for the reporting requirements, as this data have to confluence at the European Environment Agency. Well, with this, I thank you for your attention. I'm looking forward to the other 2 presentations. Thank you very much indeed, and thanks for having me out.
Thank you very much, Bernd, for this presentation that I think everyone was really keen to have. So I apologize in advance for the speakers. I use a bit the Commission Joker card, and I gave a bit more time to Bernd for his presentation. So I hope that's okay. So just I see already someone that asked as long as Claudia and Brett will prepare themselves for the next presentation. So yes, the presentation will be shared. And again, please do not hesitate to use the Q&A function to ask questions to the participants, as we will take them after it. Now that I say this, I will reshare the screen from my side as well with Claudia and Brett's presentation. And here, okay. And we can start directly with the next one, which is here, and you should be able to see it into presentation, right?
Thank you.
Perfect.
And so good morning, everyone. First of all, I would like to thank everyone who joined this morning on this important topic. And of course, I would like to thank the Commission and Bernd for this very, very good presentation and for reassuming actually what is the state of the play. If you go to the next slide, I very briefly would like to highlight on the fact that Bernd explained that very well. He spoke many times about the implementing act. And from my side, I would like to highlight how important is the choice of the tool of the European policymaker, legislator in this specific case. So instead of having any other tool, it is an implementing act. It's the most flexible legislative tool at the European Union level. It means that it is allowing the Commission to set the ground and to go back and in a very administrative and simple process, actually revise it whenever it is needed. So this is a very first step towards that flexibility that Bernd was mentioning. And why it's so? It's so because it is AMR. We've been talking over the last years a lot about AMR, and we had a break when SARS-CoV came. But the research has been there, and the member states have been working on their sites, and academia as well. And the legislation came with a request for a number of urban wastewater treatment factories. These are the numbers of the Commission. It is around 1,300 urban wastewater treatment factories that will need to monitor the AMR. How they will do so, the whole discussion around how and why it is, can you go to the next slide? It has been the core of this whole journey that the Commission has started and where we have been part of the stakeholders. An initial proposal of the Commission, which was looking towards genotype only, was then maybe lacking of that preparedness of information that is provided by the viability of the bacteria, which is resistant to certain antibiotics. And therefore, we very much welcome the current proposal that is on the table, with the so-called dual approach, looking at the phenotype and both the genotype as well, because we need to make sure what is dangerous right now on the factories, what the treatment allowed, and what is the predicting opportunities, which is the danger for the future. So that is a very important element to keep in mind here of the dual approach. And if you go to the next slide, there are different tools to monitor. And Bernd mentioned that right on saying, yes, there are different methods on the table. We are looking at the culture-based and PCR for the routine monitoring. And of course, metagenomics provides a very nice overview and picture of everything which is there, but maybe it's too much to request that on a mandatory basis because of the cost, because of the availability of the tools across Europe for the time being. And when we look at the culture-based, we are here talking about ISO-based methods. And ISO-based methods means that they are globally recognized and they are not property owned, be that a culture or a plate method. There are then some differences, then my colleague will go a little bit more into detail into that. The choice of the tool can come with advantages or disadvantages. You can get more information faster or not, or you can get less costs, more costs. So these are really the choice. Should be we support the idea of the Commission on leaving that to the choice of the user. So what they are used, what is the lab equipped with, and what they can deal with in their daily monitoring. Same for the PCR and for the genes as well. There are different tools as well, and again, the link with the metagenomics there, it's very, very, very thin. I would like to go to the next slide and highlight an important element. So We have been working again as stakeholders together with a number of organizations as well, and we have been reviewing a number of studies. The tool is there to serve a purpose, and the purpose for the time being at the European Union level, at the Urban Wastewater Treatment Directive, is to have more information. On the other hand, when we speak about water quality and we look across all the relevant water policies, like that's drinking water, bathing water, reuse water, and you name it, we come across minimum requirements in terms of bacterial when it comes to bathing and all these directives. And the minimum baseline is at least E. coli and enterococci. Certainly for the hospital environments, Pseudomonas aeruginosa are very, very relevant, as well as Legionella pneumophila. For example, the Netherlands are working very, very much on the urban wastewater project and Legionella pneumophila growth. Another important element that is highlighted in WHO recommendations is certainly the Klebsiella. While we understand the choice of leaving the Klebsiella out because of the lack of harmonized approach, at least for the time being. The genes, we see no much contradiction on that because it's very similar to the ones that have been the top, let's say, One Health approach genes. And as well for what we believe it's a minimum sampling, meaningful sampling frequency, it is 4 times per year, the inlet outlet, because that with the combined information of the viability and the genes presence, that would allow, let's say, some predictive tools and being able to run proper risk assessment in the future. So with that, I would like to go to the next slide and allow my colleague to go and provide a specific example on how this is done. Thank you for that.
Thank you, everybody, and welcome. Thank you, Bernd, for framing this very, very nicely, and also for Claudia for setting the scene a little bit more. I'm going to focus more on the technical side of things. So looking specifically at liquid culture here, we're looking at ISO 9308-2, and this is an 18-hour test, typically, for total coliforms, including E. coli. One of the advantages of using these methods is they are globally recognized. They're included within US standard methods. It's an ISO standard, a European norm. So very widely recognized, very widely used. And also for multiple water types, not just for drinking water, but also for bathing waters and waste waters, importantly. Next slide, please. Very simple procedure. All of the reagents are provided along with some peripherals. You simply take your water sample, you're adding reagent to the sample, adding it to a quantification device and sealing that quantification device, and then incubating and reading the results. Next slide, please. Reading the results is also very simple. There's a colorimetric change if there are total coliforms present in the sample. And if there's color and also fluorescence, then we can confirm that that total coliform is in fact E. coli. Next slide, please. I'm not going to go through all of these verbatim. You'll have access to the slides, and so you can read these at your leisure. But there is an ease of use factor here. There's not much training involved in being able to run samples and also interpret the results. The results are typically rapid for bacterial culture methods, at least. It's probably not as quick as PCR, but it's also rapid, and it gives you that quantitative result. There's a lot of operational flexibility. You can operate at low biosafety levels. They are portable devices. There's a lot of global applicability, again, because these are ISO standards, they're in standard methods, they're in use globally. And you can also adapt the protocols for other organisms such as Pseudomonas enterococci. And they're fairly cost effective. PCR, although it does have some great advantages, tends to be a little bit more expensive than the culture side. One important thing that I really do want to mention is that, as Bernd indicated, part of the reason for doing AMR monitoring is data gathering, understanding the systems, and helping use that data to inform our decisions, and our future actions. And because these methods are very, very simple, they're very robust, and they have high levels of repeatability and reproducibility, you can compare data from multiple laboratories within multiple member states. And that gives you a lot of information about what's happening on a more geographically wide scale. Next slide, please, and I'll finish up pretty quickly here. So here we're looking at just an example with beta-lactam antibiotics that influence cell wall formation. We're looking for ESBL bacteria with qPCR. We get an idea that the antimicrobial resistance genes are present and ESBL are present in that sample. Using the culture methods, we know that ESBL are present and have been isolated and also quantified. So there are advantages and disadvantages, as Claudia indicated. Next slide, please. And again, very, very simple to do. In this case, we would run 2 samples. One sample, we would include an amount of a particular antibiotic, and the second sample we would run without the antibiotic, and we'd get quantified results for the number of, in this case, total coliforms and E. coli present in each of those samples. And the last slide, I believe. So in this case, we've got an MPN of 5 when we include the antibiotic. We have an MPN of 25 when we don't include the antibiotic. So in this case, we have 20% of E. coli isolated that are resistant to cefotaxime. And you can do trending over time using that. And again, in multiple laboratories, in multiple member states. And with that, I thank you for your time, and I will hand over to Sophie Courtois.
Thank you very much for your presentation. I saw just 1 or 2 questions, so we'll keep them for after it. And as you said, we'll go directly to Sophie's presentation as we are a bit late, but nothing dramatic. Let me just refine. Sophie, where do I have your presentation open? Why don't I see it? I'm so sorry.
Thank you, Arthur.
Yes.
Just, I would like to thank the organizer to have invited me to this very interesting session, and I will provide you some highlights regarding our past activity in research in order to tackle the issue related to AMR in the environment. First slide, please. In order to address the rising threat of drug resistance, we launched since 2010 different research initiatives in order to better understand the impact of wastewater treatment plants within the One Health approach. In particular, we addressed 2 main questions. The first one is which role does the environment, and especially the wastewater treatment, play in disseminating antimicrobial resistance, and as a water utility, or can we contribute to mitigate this issue? Next slide, yes. In the first part of my presentation, I will share some works that we participated in order to better assess the global AMR occurrence and possible strategy to control this dissemination. In 2018, we participated in this following systematic review. It was done at the initiative of French Ministry of Ecological and Inclusive Transition. And the goal of this study was to review the literature on strategies to control dissemination of antibiotic-resistant bacteria and antibiotic-resistant genes, and as well mobile genetic elements. It provided an overall overview on the level of knowledge on the efficiency of interventions such as wastewater treatment and sludge treatment to mitigate and reduce the level of pollution. For example, up to 781 studies, publications, and reports were identified during this systematic review regarding liquid and solid matrices within the different environmental compartments. In the paper and in the tables that I put in this slide, a partial efficiency of wastewater treatment plants was observed to reduce antibiotic resistance in treated effluents, and it was validated by selecting 118 study among the whole set of paper published at this date. This paper provides also some interesting input regarding sludge treatment. The systematic analysis provided strong strength towards the efficiency of thermophilic organic waste treatment, such as anaerobic and composting. So it was a first step that we done in more than 6 years ago. And next slide, please. In parallel, we also initiated a first study to better understanding the occurrence of antimicrobial resistance in water system, including wastewater treatment plant and drinking water stations, in order to define which kind of strategy can be used to help to its reduction of AMR resistance. So we used a new analytical procedure and bioinformatics using metagenomic, amplicon metapargodin using 16S genes, but also Judkin whole metagenomics. It was done to better characterize the structure and function of the microbial communities and the diversity of antibiotic-resistant genes along the water cycle. So 60 samples were analyzed from the water resource, drinking water treatment plant outlet, influent and effluent of wastewater treatment. Which work was done in Europe scale in France by selecting different sites in France, in Spain, and in the Netherlands. This work was also done in partnership with UWWTD. The result of shotgun metagenomic suggested that the ARG's diversity and their patterns were more influenced by the treatment themselves than the initial diversity, because we show that similar pattern depending of the different sites. So this primary study covers the different questions related to AMR occurrence in the environment. And in the second section, we focused more deeply about the strategy to remove and to control the antibiotic resistance in wastewater treatment plants. Next slide. You can switch, go further directly to the two main questions that we addressed for this section. First, we study and attempt to follow the selection and horizontal transfer especially in the compartment of activated sludge. And the second question was do advanced treatments as we can use for removing micropollutants can also be used to remove and destroy antibiotic resistant bacteria and genes. Next slide. So I put some other papers that we published. The first one was focused about the dissemination of a multiple antibiotic resistance plasmid that was isolated in wastewater treatment plant in activated sludge, and when it has been harbored in donor E. coli, we follow the behavior of both donor bacteria and model plasmid when it has been inoculated in activated sludge microcosms. In this study, we showed that in aerated activated sludge, the plasmid did not persist due to the loss of not persistence of the donor bacteria. The result also suggested that, by contrast, some other treatment configurations, such like fixed biofilm reactor, could be more favorable to maintain the persistence of these antibiotic-resistant genes in our biological processes. So it was preliminary result in the past, but I think it's also an important topic to cover the risk of antibiotic resistance. It's not only bacteria and genes, it's also the capacity to transfer to other species and especially the pathogens. Next slide. And to finish about this panorama of our different action, I would like to mention the two recent papers that we published in relation with the advanced treatments. What are their efficiency to remove antibiotic resistance? So we applied a set of indicators. Indicators included bacteria and genes, and these genes was also included in the previous list that has been presented in the two previous presentation. And by this way, we are able to assess and to determine the log removal of bacteria and genes related to antibiotic resistance. Overall, all this experience also highlights the needs for standardization and to use the same indicators in order to be comparable to other studies. So I'm fully agree with this side point. So it's why more recently we also contribute towards the standardization of methods. So it's the last section of my presentation. Last year, we initiated this action in the framework of AFNOR, so French National Standardization Organization, within the T90D committee dedicated to microbial water quality, and a working group that I'm the lucky convener has initiated a work for writing a new standards for the detection and quantification of antibiotic-resistant genes using real-time and digital PCR. In the current status, we worked on the protocol previously developed and validated by a French academic network, AMR environment, that identify 4 main indicators in T1, a gene marker related to for human activity signature, another ADA with animal activity signature, and with a global marker for the total prokaryote biomass. So we started to write this document by defining sampling conditions for wastewater samples and surface water, as it was used in the EIONET study. We follow also the general requirement defined by the recent ISO TS 16099 in order to comply with the requirement and for validation of PCR methods. But this document is still open and could be easily adaptable to integrate new ARG markers. So to conclude and to let some time for the questions, my point was to show that these tools can also be used to investigate the dynamic of resistance during wastewater treatments and to study the strategies for improved elimination of resistant bacteria and oncogenes. And as it was highlighted, we really need to have a selection of appropriate target indicators and standardized analytical methods. It's on the good way as we can show in this session. Thank you for your attention.
Thank you very much. Thank you very much for all of you for your presentation. So I think, Bernd, we have two questions for you directly into the Q&A. So the first one is, what concentration or range of what antibiotic will be implemented in a culture-based approach, or is it up to the member state? And we had another one, which is under the Recast Urban Wastewater Treatment Directive, AMR is currently framed as a wastewater surveillance obligation. Does the Commission expect this to remain primarily a monitoring/public health intelligence requirement, or will AMR monitoring data be used in member state risk assessments or permitting decision under the Urban Wastewater Treatment Directive?
Okay.
And could end up triggering additional treatment needs. So that's two questions for you first.
Okay, so let's start with the concentration one. Since we are not talking about specific risks, we don't talk about specific requirements in terms of limit of detections, and implementing act will not establish this. It's about knowledge generation. That has to do a little bit with this discussion about which of the two culture-based approaches is more sensitive than the other. I think it's too premature to embark into this discussion. It's, by the way, another comment I answered on the question why we don't include specific substances, and for the same reason, why single out now one antibiotic or one agent compared to another one? We are not talking about risks. We talk about knowledge generation. So it's a starting point. And sometimes those who are the most fierce in advocating for one method or another, by doing so, are actually creating an obstacle in implementing and getting started. So if ever we would like to come to a definition of a risk, we need first to create a knowledge base. So by pushing into one approach rather than another for whatever valid scientific reasons you may think you have, you're actually obstaculating that this is going to happen. As regards the use of the data, it's a little bit the same thing. Do we have a risk? I think the Commission acknowledges in the recital of the directive that we cannot answer the question. What we see is that unlike other cases, for instance, microplastics, wastewater treatment plants, where wastewater treatment plants or the treatment process is not a source of the pollutant, it could be, depending on what we are doing at the treatment process, that we are augmenting actually the presence of an AMR ARG. We don't know. And as we don't know actually what are the consequences of what we are doing. So the use of the data is something that will indeed emerge from the collection. Obviously, I understand the interest in the public health side. The interest in the public health side is not only a scientific one, it's also a financing one. Because if you would say that this is used in public health perspectives, you have to allocate a budget. Now, this is not the task of the Commission in this implementing act to advocate for one or another use case. Our task is to give a cost evaluation, how much it costs. Who's going to pay for that? This is an entire different discussion, at least not to be led by the JRC. So that's as much as I can say.
Thank you very much. So I see also in the Q&A, if some of you ask you questions, that some of them were already replied in written by the speaker. So thank you very much for this. I think we have, so this one is done. I think I have still two. Claudia, I think there's one for IDEXX. Can you see it?
Yes, I see it. I think it's the one from Latvia, right?
Yes.
Okay. So I'm not sure I understand very well the question, because IDEXX, IDEXX is one company serving, as Bernd was mentioning, one specific ISO standard. So whenever that specific ISO standard is served by IDEXX, it is certainly for simplicity and so on, but it also complies with all the other requirements. So it means that it's certified and accredited and can be used for compliance purposes. So it is not the choice of simplicity only, but a bunch of other elements that the lab takes into account. And for what I'm aware, IDEXX's methods are generally used also for compliance methods across the globe, not only at European level. So if I was clear about that, or please follow in the writing. Thank you.
Thank you very much. Sophie, do you see any questions or points you would like to raise, or general comments? You're still muted, right?
Sorry. No, I don't have another.
Okay, otherwise I'm looking at the two in the chat. I don't know if one of you, if you have a last comments. Otherwise, I think, Ben, there is a bit of a call for having EU uniform data and in the last two questions. So I would say the hot potato might come back to you.
That goes directly to Copenhagen, not to me. So we do work with health practitioners in particular. So this is really the clinicians and not the public health on data standards, data formats. But the reporting format is something that is not being dealt with by the JRC, but the Environment Agency.
Yes. Thank you very much. Also, I think you replied to some comments in the chat. So I would like just to add from EWA, because I forgot to add it before your presentation, that we were also hoping to have some, let's say, clear baselines for operator on how to achieve this AMR monitoring and for them to be flexible. So I think when you already reply on those points, so thanks again for the Commission for all the work you did on it, and to the GRC and the colleagues. Ben, I think so far everyone is really happy with the proposal on the table. We'll see what will be the last version. So as you said, potentially not July, but maybe autumn, but fair enough. You are already under so much stress. So I would like from my side, otherwise, to share my screen one last time, just because I would like to thank you all for your participation today and for your discussion. Again, the presentation will be shared with you today. The recording will be shared as well. Regarding EWA, you also have our LinkedIn page where you can follow our activities. Our website, you can subscribe to our newsletter. We have early July, I think, another EWA IDEXX webinar on water reuse. So you will have more information soon. And once you will leave the call, please take the 2 seconds to answer the survey, to provide feedback so we can do even better next time. But once again, thank you very much to everyone and to our 3 speakers for taking this time. I think we saw that between the participation and the questions, there is a need on appetite for clarification on it. So I think the implementing acts will come really timely. And I'm sure for the 3 or 4 of you, sorry, it's not the last time that you will be talking about the Urban Wastewater Treatment Directive and AMR. So once again, thank you very much. And for once, we are on time. So I wish you a good rest of the day and potentially lunch break or next meeting directly. Thank you very much.
Thank you.
Thanks, everybody.
Thanks for having me.
Thank you.
Thank you. Bye.
Bye. Bye-bye.